name's Alan Crombie. I've been with Infinity Blue for, I think, as long as Infinity Blue have been here, but as long as we've been in, well, we'll stay in Moulin. So it's just after we moved into Moulin, which is 11, 12 years now. I had an abscess up here, and it seemed to jump from tooth to tooth. And I'd lost various other teeth beforehand, so it was obvious I was going to need pretty much a full set on the top teeth. And Carolyn suggested I get implants. I've got implants down in the lower ones at the front, which Mr. Barrowman put in a couple of years ago. So basically that was the decision. Rather than have a full plate with going across the palate, I would get the implants and have that much less in my mouth. It was basically a choice between implants and skinny with skinny dentures or a full set of dentures, and I didn't fancy the full set of dentures. Well, I lost the teeth that were causing grief, and I got a temporary plate in and sat with that for a couple of months. I can't remember quite how much. I need to look at my diary. And then got various x-rays and MRI scans and bits and pieces like that. And then Carolyn operated and put the 4 implants in, and I sat with that and the temporary plate, which is now realigned to account for what was inside. And September, I think it would be, she took the impressions for my new teeth, and here I am. New teeth in time. Well, we're in time for Christmas. Well, I'm quite confident talking, whereas with the temporary plate, I was tending to talk a little bit like this. But now I can orate. I tutored with the Open University, so all of that was online, and you see yourself. You know, when you stand in front of a class, you see the class, whereas if you're doing it on a Zoom or a Teams or anything online, there's you down in the bottom corner smiling back at yourself, and you become quite self-conscious. And having the full set in that doesn't wobble about and you don't feel it's liable to wobble about feels a lot better. It's confidence rather than anything particular being wrong. I would say it's chalk and cheese. You notice the difference, and my mouth feels very much more normal.